Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Ophthalmologist, but then she realised that ears, nose and throats were more fascinating field and involved surgery, etc. Actually, we had a very interesting conversation about my young deaf friend, who many of you know, or have seen about on Facebook, etc. So I'm super delighted to recommend. This is definitely, I think, the first time we've ever had anything on ears, nose, and throats ever. So I'm super delighted, but to invite Dr. Apiradee to the stage and give her a huge round of applause. She's been a doctor at BPH for 5 years. So, Dr. Apiradee.
Good morning, everyone. I am Dr. Apiradee. Okay. Also, you can hear me well, everybody? Yep. Okay. Thank you. Today is my honor to talk with you about the topic of the pollution. Okay. We start with the video.
Enough about pollution. We think of pollution as an environmental issue. We do not think of pollution as a health issue.
It kills more people than war, than hunger, than malaria or AIDS or tuberculosis. All of these pale in comparison.
In 2015, pollution-related diseases accounted for 9.6 million deaths. 92% of that burden is in low and middle income countries. That's big for us. It's big in terms of the distribution of the problem. To put it in plain speak, the distribution is unfair.
It's not been on the public radar because there's been a lack of understanding of just how endemic this problem is and how many people are impacted. It's been forgotten.
We need to make people aware that pollution is damaging them, damaging their children. It may not be visible, but it's nonetheless very real.
It is about a huge loss of
like connection is not too good, but it's just like an introduction that show how the pollution affects to us. Okay. Next slide. Okay, so as we know that the pollution is the problem that we are facing all around the world. According to WHO, we found that 7 million people die from the pollution. And in Thailand and Southeast Asia, over 2 million people die from the pollution. So I will talk without the slide, okay? Okay, so in the air, it's not only the oxygen that's useful for our body. We have many gases and some particles that in the air. But the most thing that we concern is that's less than 2.5 micron. I will show you that why the 2.5 micron particle, or we call PM5, is very important. Okay, so slide. Okay, this slide that I mentioned before about the 7 million people die from the air pollution from many causes: the stroke, the heart disease, the lung cancer, or the respiratory problems. And in Thailand and Southeast Asia, where we live, approximately over 2 million people die from pollution. Okay, and where the pollution from? Most of them from the vehicle emission in the cities. and some from the biomass burning, such as in Chiang Mai right now. They burn a lot of forest for grow something that cause the pollution. And about the transboundary hazards in the rural, such as the Dr. Rain mentioned from Cambodia, or the industrial discharge from the industrial zone, such as Chonburi and Rayong province, that we are the industrial zone. And I already mentioned you that in the air, it's not only have the oxygen, but there are many gases in the air. But we concerned about the, we are concerned about the 2.5 ppm, or the particle that less than 2.5 micron. Why the 2.5 ppm is very important? Because the smaller size of the particle can go deep down to your respiratory tract. If the particle approximately 10 micron, it can lead to lower respiratory tract. But if the particle is approximately 2.5 micron, or we call PM 2.5, it may reach to your alveoli. What is the alveoli? The alveoli is like a small sac that where is the gas exchange to your bloodstream. So that means if this particle can penetrate to your alveoli or your lung, it can go to your bloodstream also and cause many side effects of your body. So according to the WHO, we recommend that the PM 2.5 not over than 25 micromillimeters per cubic square meter, and 10 ppm should not over than 50, because every 10 microgram that increasing, it will increase mortality rate approximately 0.46%. Okay, so what does the 2.5 ppm cause the health effect? First we start like once you breathe the air into your nose, because the nose is the first organ that detect the air pollution. Once the air pollution go inside your nose try to get this pollution out by cause some effect. They will release some cytokine or some inflammation factor to get the particle out. So this inflammation factor will cause your nose become more swollen and produce some mucus discharge. And after that, once the mucus discharge inside your nose, normally in your nose you have some small hair that help to get rid all the dirt thing out. But you think that like some hair that you have water on top, so the hair function is lost. So make the bacteria that can go to your nose also can grow and cause some infection. This one can turn to acute sinus infection. And not only that, it can cause a chronic problem also, such as the polyps in your nose that could be cause permanent block and maybe lead to the surgery to correct this problem. And not only the nose, they can spread to the eye. In some patients, you're going to have problem with the eye itching, redness, and after that the infection is come after. And once that the pollution go from the nose, they go to the throat and cause throat irritation. You will have the chronic cough and bronchitis. And once that they go to your lung, the inflammation process will start and cause the lung inflammation and lead to the lung cancer. And that I told you already, that once it go down to your alveoli, they can exchange to the bloodstream. And this particle will go to your brain and your heart and cause stroke and some heart problem. From the million people that die from the air pollution, we found that 21% is die from the pneumonia, like from the lung infection, 20% from the stroke, and 34% from the ischemic heart disease, 19% from the lung disease, or we call COPD or asthma, and 7% from the lung cancer. So if you think that the air pollution just caused only the nose problems or the eye problem, because it's like a suddenly disease that you once you start to expose the pollution, it's not, because it's like a silent killing. It can provoke your problem such as the brain and the heart, that is a life-threatening problem. So recently, in many months, I think from like November to March and to right now, I found many patients visit me at the clinic, but most of them they're concerned about running nose, sneezing, because it's like an obviously problem that you can facing right now. But they didn't know that it could be caused the dangerous, like life-threatening, as like stroke or heart problem. This is a video that shows how the particle affect to your body.
Air pollution, it lurks all around us, preying on the young and old. It slips unnoticed past your defenses and assaults your lungs, heart, and brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight
Okay, maybe this is last video. Okay, this section is about how dangerous of the pollution and where it's from. So at this, next I will talk about how to prevent yourself from the pollution. Okay, so first of all, you need to wear the face mask every time you go out from your place. Okay, so I recommend you to use a high quality mask. This is a mask that used for the PM 2.5. But just in case you don't have this kind of mask, I have the tip for you. Normally, the surgical face mask that right now you wear, it can remove off the particle approximately 60%. But if you use the tissue paper for 2 pieces, and underneath your mask, it can remove the PM 2.5 up to 90%. And not only that, you can change during the day to your hygiene while you during the mask in the COVID era. Okay, so next, after you're wearing the mask, you need to make your body to be fit by, this is a basically that everyone should be do. Like first, you need to have enough sleep, at least 6 to 8 hours per day. Do the exercise at least 30 minutes, 2 times a week. I recommend to do the indoor exercise one that the pollution happen, because if you go outside and do the exercise, it's more harmful to your body than useful. Okay, and you can boost your immunity by some fruit, some like a vegetable, or take some vitamin C. And the question is, how milligram of vitamin C that's suitable for you? I recommend at least 500 to 1000 milligram per day. But in patients that have problem with the stomach, like a peptic ulcer, I recommend you to just split like a 500 milligram morning and evening to avoid the side effect of the vitamin C. Because the vitamin C, like acid, it can a little bit irritate your stomach and cause some like burning sensation in your stomach or stomach pain. Okay? In the high risk group, who is the high risk group? The high risk group is the patient that have the underlying disease, especially in the heart, lung, and some patient that have allergy. You should to be prepare your medication, because just in case you have side effect from the air pollution, you can use your medication. In patients who have the allergy, I recommend you to use some antihistamine, any brand that you have in your home, okay? And second, do the nasal wash. In this room, who have experience to do the nasal wash before? Okay, so 1, 2, 3, just few percent, right? I will talk a little bit about the useful of the nasal wash. The nasal wash is just you use your saline, or we call 0.9% of sodium chloride. This one you need to warm before to make like the temperature of the saline closely to your body temperature. And the way to do is very easy. To put the saline into your nose, one side, and the water will come out to another side. The reason that we recommend patients to do the nasal wash is, like I told you that when your nose has some inflammation, you have a lot of mucus inside, and this mucus is the source of the infection. The saline solution can get rid all the mucus out, and not only the mucus, the dust or the particle that live in your nose will go out and make your nose become more clean. And not only that, in patients that use the nasal spray, they will increase the efficacy of the spray, because once that you have the mucus over your nasal tissue, the mucus will interrupt the absorption of the medication. Many patients use the nasal spray and it does not work. Once I told back, like I asked them about how to use the spray, they use without nasal wash, so the efficacy of the nasal spray will less. It seems like you use medication every day, but it's not function. At first, I have the video that how to teach you how to clean the nose, but I think today I cannot find in this, so maybe next time I will show you how to clean the nose in the right way. But it's very important, because clean the nose is the procedure that quite safe and you can do more often. In patient, I would like to know that in this room, we have the allergy problems, the nose. Okay, but you never know how to clean the nose before, right? Yeah. And what kind of medication that you use when you have the allergy? Antihistamine. The tablet? Yeah. Pardon? Oh, Sudafed. This is one of that have the decongestion, so it makes the nose open, but have some side effect to in case that you have the heart problem. I don't recommend. Okay. And another one's nasal cord. Okay, this is cortisone. Okay. Octreotide. How often did you use octreotide? Okay. How long does you use? Few days, stop, or continuously? Yeah, right. Because many patients that have allergy will use the medication vary, but the Octavin is the one that you mentioned. It has a problem if you use for long time. This one is kind of the problem that we found a lot in patients who have allergy, because once you go to over-counter, they will give you the Octavin because it's a good medication. You use it, it's open your nose suddenly, right? And you feel more comfortable, but it's long term. It can cause the rebound effect and cause permanently block, and that's difficult to correct. But the saline solution to wash your nose is quite safe and you can use for long term. Okay, so this one I will open to you to ask the question after I talk about this topic. Okay, so next, the bronchodilator in patients who have the lung problems such as asthma or COPD. This is very important because the pollution can make your airway become smaller and the air cannot go into your lung and cause some less the oxygen in your brain and make some a collapse or some lack of oxygen to supply to your brain. In case that you have the asthma and COPD, you need to have some bronchodilator. Who use some bronchodilators? Okay. So how often do you use since the pollution happens? Daily. Not controller, just for the reliever. The reliever. Some Ventolin that help to open the air, right? Use every day? Yeah. So that means the pollution is too bad right now and the control is not too good. Okay. But I recommend you to have this because it can suddenly happen. Okay. So next, check your daily air quality. You can download the application. I use IQ Air Visual. It is like this. You can download from the iPhone or Android, and it shows you that where the place where you live, and the colors and the air index. This one, the color has meaning. I will show you this. They divide into 6 colors. If the color in blue or green is quite safe for you to use your light as normal. But in yellow, it means in patients that have a high risk group should to be aware that the pollution had 2.5 ppm enough to aggravate your underlying disease. And if the color show red and purple or dark purple, it means even you are normal people, you have effect from the pollution. Okay, so you can download the application or you can open from this website to check the pollution every day before you go to outside, because if the day that the pollution is too bad, we recommend you to stay inside your home and avoid the outdoor activities. Okay, this is the one that I talked. Avoid outdoor activity and close your door and window. Next is install an air purifier. The air purifier, you need to make it sure with the seller that the filter that they use can filtrate the PM 2.5, because there is many brand of the air purifier, but the different thing is the filter inside. Some filter can even filter some virus or some PM 2.5, but some brand it not. So you every time you make a decision to buy, you need to ask your seller first that they have this kind of filter or not. And next, visit your doctor in case that you have experience of breathing problems. So actually I have video for Watch Your Note, but today I think we cannot open for you. So next time. So next about the question. We have the question about, it's like you can ask me every question, not only the air pollution, the rhinitis, even the ear, nose, throat feel, you can ask me all. Okay, you first.
Thank you. Good presentation. Noting the vehicle pollution in Thailand, which is probably the worst of any country I've ever lived in, do you think the health minister ever talks to the transport minister in Thailand, in the Thai government?
I think this problem is discussed. Many people try to mention about the pollution, but right now I think the government tried to fix in many ways, but I didn't see that the way that changed a lot. Even they try to change the car to EV, electric, and avoid some burning of the forest, but not success right now. So I think maybe help yourself is good for us right now. But in the future, I hope. Okay, so.
Since you're an ears, nose, and throat doctor, I go occasionally get my ears cleaned, at the different barber shops where they go in and scrape the ear. Do you recommend that, or just a professional opinion on having that done?
In my view, I don't recommend you to do like that, okay? Because I have many patients that have the complication from the ear cleaning from outside, okay? So I will tell you about basically to look after your ear, okay? Normally, the ear is like a J shape. The outer 1/3 of your ear canal is the part that produces the wax. And you have the hair inside that can get it out by itself, okay? But in some patients, this hair function is lost, or the humidities or some activities make your ear produce a lot of wax. So it's called the wax a lot inside. But once that you use some Q-tip or anything to clean the wax out, the way you use is like you put the wax more deep inside, because the ear canal, the part that build up the wax is just outer 1/3. It's very easy for doctor to clean it out, but when you put it deep inside, and especially close to your eardrum, it's difficult to remove because the eardrum has many nerves to supply. So once that we try to clean it out, you're gonna feel pain more than the doctor get it out from the outside. And not only that, they can provoke the infection and ear trauma. Many patients visit hospital due to the Q-tip. Why they use the Q-tip? Maybe dog, maybe his son and his daughter hit their hand and cause the eardrum perforation. And after that, it can cause like a loss of hearing. So the question that what is the best way to look after your ear? My answer is let it be. Do not put anything inside. Let your body work it for you. And just in case it's not work, you come to hospital. The cleaning is so easy, okay?
Yes, doctor. I'm looking at the the thing today, the air, but I don't quite understand what everything means here. This says 2.5, and then after that it says PM10. What does that mean?
Oh, yeah. This is the size of particle. The 2.5 is 2.5 micron. The PM10 is 10 micron. So the 10 micron can reach to your lung, but the 2.5 PM can lead into your alveoli, the small part that gas exchange. Okay, so if you ask me that which one compare about 2.5 ppm and 10 ppm, which one is worst one is 2.5 ppm, and they show 85 is air index, and the color I mentioned already.
It's yellow, yeah.
Yeah.
And it
It's
says
like
moderate. And
moderate. In there has like the yellow color is mean it will cause the problem in the high risk group. Okay, so that means normal people we don't feel much, but in the high risk group should be beware because it can cause the nose problem or respiratory problems.
Thank you.
You're welcome.
Ryan.
What are some of the foods people can eat to help them have a better health in their lungs?
Oh, okay. So normally we recommend the fruit and vegetable that high vitamin C because we have evidence to know that the vitamin C is an antioxidant. So when you breathe some pollution, it's called inflammation process and produce some oxidant that destroy your lung. So the fruit or vegetable has some high vitamin C that like we call antioxidant. It's not only help about your lung, but it help you look younger, okay? Okay, you use microphone, please.
Does it help for only some kind of vegetables, or does it help for all kinds of vegetables?
Some kind of vegetable. I think the vegetable you can eat it all, but in the fruit you need to beware. In some fruit that like a high sugar, okay. So normally we recommend like some sour, like orange, berry that have high vitamin C. But for vegetable, I think you can eat it all. It's okay.
Hi, thanks for your talk. I have a meter here that meters the air quality.
Okay.
And I find that the best thing, if you're in a car, for instance, if you put it into internal circulation, the AQI, the air quality index, goes down to more or less zero. Depends on what your filter is. So I can highly recommend that you do that if you're in a car. I sleep with a HEPA filter. You know the HEPA filters?
Yeah, I know that.
Which also take it down to practically zero. But fortunately, I can't stop it if I go on the golf course or whatever. But however, my question is, I also on this meter have HCHO, which I don't understand, a TVOC, which is actually always tells me it's safe. Okay, that's good. Thank you.
Yes, Doctor. Just what is your take on the reduction of natural forests within the world and pollution?
About what?
Well, the forests are being diminished gradually all over the world.
Yes, right.
Do you agree that that affects
Oh yeah, absolutely.
the air quality?
Yeah. Because
But what can people do about it? Big business.
I think we have to help all. The decrease of the forest is very important because normally like the tree can help us like natural air purifier, and once that the forest is less down, the air purifier, I mean the world air purifier is less and cause and not only that, the less of the forest it can cause like some greenhouse effect and that cause the pollution problem more and more. Okay.
Thank you, Dr. Apiradee, for a really, really wonderful talk. Very timely. I have this impression. Unfortunately, we don't have the meetings on Sunday mornings, so I try to get out of Pattaya and go for a walk somewhere else. So I go to Khao Mai Kiao, right? The what I call Banglamong forest out there, and because I feel that I'm walking surrounded by trees that are hopefully absorbing pollution and pumping out fresh oxygen. Is that a myth, or is actually am I healthier surrounded in a forest by trees pumping out oxygen?
About the walking?
Yeah, walking in a forest is better than walking in open ground, right?
Yes, right. Because there is some kind of the tree that we recommend in some patient to plant in your house about reduce the pollution. But I have to say like this. But the time that before you make a decision to go outside, you need to recheck the pollution, because if it's higher, maybe walking in the forest maybe not help you, because the pollution is worse than the tree can help. Maybe do the indoor activity is better, such as if it's red or purple, maybe we recommend you stay in indoor.
Okay, Doc.
In Thailand, where would you say is in Thailand, where would you say is the most polluted and least polluted region?
Okay, so I think it's vary on the climate, but mostly that in Thailand, I think maybe northern area in Chiang Mai. I think maybe depend on the climate, and as I told you, the transboundary area also. But right now that have most problem is in northern area, unless I think maybe in south part, because of the south has the rain more than the other region. One that the rain is raining, so it can make the pollution less. So I think maybe my answer is northern is worst part in Thailand, and the best part in Thailand may be south.
Doctor, if I am outside a lot and I have to wear the mask a lot, is there really a problem about reducing your intake of air, your intake of oxygen? Are you actually stressing your body more by not being able to breathe so much?
Okay. So this question, we have ever discussed when the COVID era first start, that use the face mask is okay for your body or not. We recommend that you can use not if you wear just surgical face mask. I think maybe 3 or 4 hours is okay to go outside. But if longer than this, you need to without this mask, because the mask can interrupt the oxygen. But the surgical is not too much, except the mask like N95, just only 1 hour maybe cause the problems. Because when your body lack of oxygen, it can produce the acid in your body a lot. You will feel dry, muscle pain after you longer use the mask. I think for surgical mask, 4 hours, continuously 4 hours is okay.
Doctor?
Is there any indication that the pollution has any effect on brain function?
Oh, absolutely. It can cause the brain problem, because like a particle can go to the bloodstream and go to your brain, but they don't tell the exactly measure that how the severe of pollution can affect to your brain, because it's like a chronic destroy of your brain, if not suddenly. So the measure that for the pollution, we don't know exactly. Yeah. But absolutely it's caused the brain problem, not only the stroke, but about the memory, your memory also.
Okay.
I'd just like to make a comment on the pollution. I've been here over 55 years. Pollution in Bangkok 55 years ago and up until the 1980s was far, far worse than it is today. The primary reason it changed is the tuk-tuks and the taxis changed over to cooking gas instead of ordinary petrol. And I lived in Pattaya 55 years ago for a year, and we had pollution then. Not as bad as now, but we did have it then. And there was hardly any cars. The pollution come from burning their crops and stuff like that.
About pollution. We think of pollution as an environmental issue. We do not.
Air pollution, it lurks all around.
Oh, okay. Pardon? Okay, you can reopen it.
Air pollution, it lurks all around us, preying on the young and old. It slips unnoticed past your defenses and assaults your lungs, heart, and brain. Its deadliest weapons are invisible, poisonous particles that can be as small as a molecule. With every breath, they break through your lungs' protective barriers. There, they trigger inflammation as your system tries desperately to fight back. But these tiny intruders penetrate those defenses, lodging toxic compounds even deeper, sowing the seeds of cancer. They slide straight into your bloodstream, sabotaging your entire body. They inflame and constrict your blood vessels, increasing blood pressure until, one day, causing a stroke. The particle prowlers dislodge fatty plaque that may have built up from your diet. They weave clots that can be deadly blockers of blood flow to your heart or brain. With each new case of heart attack, stroke, lung disease, or cancer, air pollution adds another life to its hit list. Let's stop this invisible killer.
The small smoke particles from air pollution, or PM 2.5, are more than 25 times smaller than the width of a human hair. As air is inhaled, particles enter the body through the nose and mouth. Air passes through the respiratory airway and finally reaches the alveoli, tiny air sacs in the deepest part of the lung. The smallest of the particles that enter the lungs diffuse through the walls of the alveoli into the bloodstream, where they are transported to all organs of the body, where they can affect normal function. Critical organs affected include the lungs, immune system, heart, and developing brain.
Enough about pollution. We think of pollution as an environmental issue. We do not think of pollution as a health issue.
It kills more people than war, than hunger.
This the first two videos. The second one is show that how the pollution can go to your how it go to your bloodstream, and the first video is show that how it affect to your body.
Any more questions to this very knowledgeable doctor? One more?
When you were saying about 2 million people die in Thailand of air pollution.
Oh, not in Southeast Asia.
Oh, right, that's what I thought. Okay. And how is that in 1 year or what?
Oh, I think 1 year.
Every 1 year.
Well, I really thought that was really excellent and informative. A huge round of applause for Dr. Apiradee. I feel I should present the certificate sideways in honour of the videos. What do you think?
Yes, I think so.
Wait a sec. Actually, we'll do one with the sideways. Just that. Thank you so much. And when I asked